So I'm not going to spend too much time on the background of the MRT, but I thought I would give a very brief recap because I think a lot of people always hear MRT, so I just wanted to give like a 2-second summary of what it is. So it's the Medicaid Redesign team. It was established about 2 years ago by executive order by Governor Cuomo, and it was really the first of its kind in the state of New York. And it was a real process that solicited both public input and stakeholder engagement in Medicaid redesign. It's a 2-phase process. I always joke that I think we're actually currently in phase 3. So we're going to amend the slides moving forward. But phase 1 was really an action plan on how to save Medicaid spending by a little over $2 billion in 11-12. Phase 2 was a lot more comprehensive of a Medicaid action multi-year plan, which incorporates the plan for MRT supportive housing. So phase 1, as I mentioned, generated a little bit over $2 billion in Medicaid savings in fiscal year 11-12, and it was completed in February of 2011. Phase 2 was a little bit more innovative, where the MRT broke into 10 distinct work groups. And the work groups are, very beneficial for the MRT because it really engages the stakeholder community and gives the stakeholder community an opportunity to provide both feedback and input into Medicaid redesign and the Medicaid process. It's a very open process. All of the meetings are public, and all of the groups produce final reports. So one of the 10 work groups that was created in the MRT was the MRT Affordable Housing Work Group. It's been up and running for nearly 2 years now. It's doubled in size. It's comprised of over, I think we're a little over 40 stakeholders. It's a real opportunity for the stakeholder community to provide both opportunities on how we should spend Medicaid dollars and how to invest these dollars into supportive housing. And it really is a great vehicle to create opportunities to contribute ideas and information on supportive housing. And I know a lot of folks ask this who participate on the work group. We gave everyone a hiatus over the summer, but we will be reconvening the MRT Affordable Housing Work Group in the fall. So what have we accomplished so far? In 2012-13, we had a $75 million Medicaid investment to invest in supportive housing initiatives. This funding, and in 13-14, that dollar amount grew to $86 million. The goal with the MRT and Medicaid is to continue to invest in supportive housing with the goal of, I think we're trying to reach $100 million within the next year or two. This funding, since it is Medicaid state-only dollars, is targeted for high-cost Medicaid users. In addition to targeting Medicaid recipients, we're also very outcome-oriented. So what we will be doing with the 12-13 and 13-14 investments is really tracking the success of the MRT Medicaid-funded programs. So Linda's going to talk about this after me, but the MRT, it's a very collaborative effort. In addition to the stakeholder community, it's a multi-agency effort. The Department of Health, OPWDD, OMH, OASIS, HCR, OTDA participate. So it's really been very collaborative in its efforts. In 12-13, I mentioned that we had $75 million in total to spend. Of that amount, we spent $46.6 million in new capital investments. So these dollars will create 12 new buildings, which will house 483 new supportive housing units. 7 of the residence buildings will be in New York City. 5 will be located in upstate New York. Linda's going to provide, an outline of what the projects are, but we're very proud, within 1 year that we were able to commit these dollars to create, 12 new buildings that will be up and running within 24 to 36 months. We've also continued this capital investment in 13-14, and the final state budget has committed $36.4 million in new capital investments, which we will be working towards for 13-14. So in addition to capital, we recognize that you must also fund rental subsidies and service supports. So the MRT committed $27.9 million in rental subsidies and service supports. When fully operational, this will support a little over 4,000 people. The programs are funded in OMH, OPWDD, OASIS, the AIDS Institute, and OTDA. The goal is to continue all of our rental subsidy and service support, so those commitments will continue in 13-14. In addition, the work group, the MRT Affordable Housing Work Group, thought that it was very important for us to also create new pilot projects to assess new models of care. Linda's going to go into more detail on this, but what we're looking to do is how do we more appropriately house individuals in institutions? Should they move out of nursing homes into the community? So we're really looking at various models with those pilot projects. They are in development currently within DOH, OTDA, and OMH, and that's what I'm calling our summer project. We're really hoping to get these new pilot projects up and running as soon as possible. So why does Medicaid invest in supportive housing? You know, I think that everybody knows that when an individual receives housing and they also have health care needs, that it will increase both the quality of care for the individual who receives housing, and in turn it will decrease Medicaid costs. So the goal here is any investment that we make in Medicaid, that any savings generated, our goal is to reinvest those dollars to increase funding for supportive housing. So this really ties into using Medicaid dollars and the tracking of these Medicaid dollars, and how we think that this investment will really improve health outcomes for Medicaid members. We believe that supportive housing will reduce Medicaid costs, and so what we've done with the MRT is any individual who receives funding through the MRT, we're asking to collect data. We're asking to collect data on individuals who receive housing, and then what we're going to do is we're going to analyze that Medicaid savings over time, and any savings, as I mentioned, that we calculate, we will reinvest those dollars into supportive housing. So the tool that we've created, we tried to keep it as simple as possible. It's essentially an Excel spreadsheet that asks for unique identifiers, such as a recipient ID, social security number, the name of the individual, when they received housing. Each agency that has received dollars through the MRT will work with the individuals who receive funding to track these dollars, and providers will be required to submit the data on a monthly basis. We hope that this time next year, when we present, we'll have some data to share on the success of the MRT programs. And I do want to reiterate, I think because this is a pretty new thing that we're doing, you know, why it is so important that this tracking tool that we're developing, it's critical to the MRT Supportive Housing Initiative. One of the things that we're trying to do, in addition to using state-only Medicaid dollars, we also submitted a waiver to the federal government. We call it the MRT Super Waiver, and the goal is to ask the federal government to share in New York State costs. And one of the things that we think will be very powerful is when we demonstrate the cost savings of these programs, that it has the potential to generate and draw down additional federal dollars as well.